Hi, I'm Dr. Kathy Judkins, and I'm going to be discussing the evaluation process and how we make a diagnosis of attention deficit hyperactivity disorder, also known as ADD and ADHD. In this video, when I use the term ADHD, I am referring to both ADD and ADHD. ADD is the group where the main presenting problem is inattention, no hyperactivity or impulsivity. Children who are diagnosed with ADHD have both inattention plus hyperactivity and impulsivity. We know that 18% of school-age children seen by pediatricians present with behavior problems. We also know from research that as much as 10% of the population has been diagnosed with ADHD. So, as you can see by looking at these numbers, not all children with behavior problems necessarily turn out to have ADHD. Our goal is to help you understand how we make an important decision about whether a child has ADHD. I'll walk you through the process of understanding the symptoms and diagnosing whether the symptoms are ADHD or something else. Let's talk about some basic facts regarding ADHD, and then we'll get into reviewing the symptoms. Boys with ADHD outnumber girls by 3 to 1. Symptoms of ADHD typically become noticeable when kids are between 3 to 6 years old. There can be some exceptions to this, such as in the case of children who have suffered a brain injury and have what we called an acquired ADHD. Let's review the actual symptoms of the different kinds of ADHD. The main symptoms of ADHD include inattention, or difficulty paying attention, hyperactivity, which is excessive movement that is considered inappropriate for that age, and impulsivity, which means that a child does not think before they act. There are 3 types of ADHD. The first is called ADHD inattentive type, or some people refer to it simply as ADD. Children with this type of ADHD are not hyperactive. These children daydream, have problems with focusing on something for a long period of time, are forgetful, and lose things often, but they are not hyperactive. The second type of ADHD is ADHD, hyperactive impulsive type. These children are described as being on the go, almost as driven by a motor, fidgety, out of their seat often, problems with interrupting others often, and having difficulty engaging in leisure activities. The third type is called ADHD combined type. This simply means that a child has symptoms present from both the inattention and the hyperactivity categories. In order for a child to be diagnosed with ADHD, the child's symptoms must be present in more than one setting or environment. For most kids, this is usually home and school. For homeschooled children, we look at behavior at home plus at least one other setting like a sports team or a club. One important thing to take into consideration is that the symptoms I just listed are developmentally normal at certain ages. So we are cautious when a 3-year-old walks into our office for an ADHD evaluation because it is normal for 3-year-olds to have some degree of inattention and increased activity level. Recently, there was research released that also highlighted the need to be cautious in the evaluation of children, especially when these children are the youngest in their class. In a study, the youngest kindergartners were 60% more likely to be diagnosed with ADHD than the oldest children in the same grade. The issue here is that there is much maturing that occurs in the early grade school years. If young kindergartners are being compared to same grade peers, they can be at a huge disadvantage because they are still maturing. The same trend, the higher percentage of ADHD in younger children, was still seen as the children advanced to higher grades. So getting an accurate diagnosis is critical from the beginning. A comprehensive evaluation will also look at multiple issues. We need to consider the fact that the symptoms that a parent sees in their child may be more than just ADHD. In other words, we could have a couple of things going on that explain why the child is struggling. Or the issues may not be ADHD at all. A good evaluation can help us decide. So let's talk about the evaluation process. The first thing to know about the evaluation process is that there is no test for ADHD. Research studies do use tests such as MRIs to document brain differences in children with and without ADHD, but the tests are only being used in research studies, not as a way to diagnose. Most of the time, parents usually start talking to their pediatrician about their concerns. This is a great place to start for many reasons, one of which is that it allows the doctor to rule out medical reasons for the child's symptoms. The doctor usually evaluates the child's hearing, vision, checks their ears to make sure there is no middle ear infection, and reviews neurological signs. In some children who have symptoms of inattention, pediatricians will talk to the parents about a family history of seizures to rule out a certain type of seizure that can cause inattention. Also, allergies can be another contributing factor in inattention in children, so we want to make sure all these issues are considered. If the doctor decides that there is no medical reason for the child's problems, he will either conduct his own ADHD evaluation or refer to a mental health provider for a more comprehensive evaluation. As I mentioned, because there can be other emotional or behavioral reasons for the child's behavior, it is recommended that the child undergo an in-depth evaluation. We've seen children whose parents call us suspicious that their child has ADHD, only to find out that the child has been having problems focusing in school because they are being bullied by others and feel disliked by their peers. Inattention and not completing assignments on time can also be signs of depression, anxiety, or learning disabilities, not only ADHD. We need to be careful in making sure we understand the reasons for the child's behavior. Just because it looks like a duck and sounds like a duck does not always mean it's a duck. An accurate diagnosis will obviously then lead to the appropriate treatment. So in the case of a child who is suffering from depression and not ADHD, treatment for that will look very different than the treatment for ADHD. So, what kind of an evaluation can you expect? If your pediatrician is doing the evaluation, the parent and school teacher will be asked to complete forms that cover a number of behaviors. Some common forms used by pediatricians are the SNAP form, which focuses on symptoms of ADHD and oppositional behavior. Another form is the Vanderbilt form, which screens for ADHD, oppositional behavior, conduct disorder, and anxiety and depression. And finally, the Conners, which has a long and short version. The pediatricians usually use shorter versions of the Conners, and the shorter form screens for ADHD and oppositional behaviors. If your pediatrician recommends an evaluation by a psychologist, what can you expect from that visit? Let's review the logistics of the visit first. For a comprehensive assessment and one that is tailored to your child, you can expect that the psychologist will talk to you first at the initial session and conduct an interview to get a history of your child's behavior. Most psychologists I know give parents the option of whether they want their child in the room at the same time for the initial session. If you feel your child might feel sensitive to your comments, ask the psychologist if you can speak to them privately. Sometimes parents request a session first without their child so they can talk openly without worrying about the effect on their child. This approach also gives you the opportunity to feel comfortable with the therapist. In our office, we always honor this request. We also have a playroom, so sometimes I will speak to the parents first while the child plays in the playroom. The child then joins us halfway through the interview. Other parents take a different approach and say that their child is really aware of their issues and does not get upset when talking about it. In those situations, we'll include the child in the first session. A good assessment will always include an interview with the child to get their perspective. Depending on how the evaluation is structured, this may or may not happen at the first visit. A psychologist evaluation starts with an in-depth interview about the family. The questions you can expect from an interview include describing the problem, when the problem started, in what settings they occur, how often do the problems happen, and how others have attempted to help the child. Do their problems affect their learning or their relationship with others? Has there been stress in their life or the parents' lives that may account for some of the child's difficulties? Do the parents have any concerns about anxiety or depression? The psychologist will then give the parents and teachers questionnaires to complete. There are many questionnaires available to therapists, but some of the more popular ones include the Child Behavior Checklist, or CBCL. This is the parent version and the teacher version. The Behavior Assessment System for Children, or the BASC. Again, we have a parent and teacher version and the Connors forms. These questionnaires have items that are computer scored and can tell us if behaviors that we are seeing in their child are typical for someone their age, or if it is considered to be a problem at that age. Depending on the age of the child, some forms also come in children's versions. The advantage with this type of in-depth evaluation is that we can gain insight from different perspectives to more fully understand the situation. In psychology, we advocate for multiple method and multiple informant in assessment of behavior problems. In other words, there is no one perfect instrument or questionnaire for making diagnostic decisions. We want to pull information from as many areas as possible to make sure the different perspectives come together. We take the information from our interview and combine it with the results of all questionnaires. Some psychologists also give computerized tests that measure inattention and impulsivity, although this is not routinely done by all psychologists. If there is any concern about whether your child truly understands his schoolwork beyond how he is affected by the symptoms of ADHD, you will also want a learning disability evaluation. Approximately 1/3 of children with ADHD can also suffer from a learning disability. A learning disability evaluation can be done by the school district, a psychologist, or a pediatric neuropsychologist who has training and expertise in this area. A comprehensive learning disability and ADHD evaluation includes all the items we mentioned for regular ADHD eval, plus IQ and academic achievement testing. Most of the time when a child has been diagnosed with ADHD, there are usually other issues or conditions that the child has too. It is not the norm for a child to only have ADHD, although this can happen. Another issue that we frequently see along with ADHD is oppositional defiant disorder. ODD describes children who are argumentative, do not take responsibility for their behavior, blame others, and who deliberately refuse to follow directions. It is also not unusual for children to show symptoms of anxiety and depression. Learning disorders are another category of concern that should be ruled out in making a diagnosis of ADHD. So, if you are thinking about having your child evaluated for ADHD, realize the person doing the eval will also be keeping their eye out for other issues, not just ADHD. Sometimes other conditions that coexist with ADHD can be thought of as a side effect of the ADHD itself. Let me explain what I mean by this. Let's say that I diagnose a 9-year-old girl, we'll call her Jamie, with ADHD. Jamie also has been having significant anxiety in school and home. She feels like she is always in trouble because of incomplete work. She's also been punished by her parents because of declining grades, not listening at home, and not finishing her chores. Now that we have diagnosed Jamie as having ADHD, we can help her and her parents understand that there is treatment for it. She's simply not just lazy or unmotivated, although she certainly appeared that way. In some children, we have seen problems like anxiety and oppositional behavior dramatically decrease once their ADHD has been properly treated. Children start feeling better about themselves, and therefore the anxiety and depression actually can decrease. This isn't always the case though. This is why if a child is diagnosed with ADHD, we recommend regular follow-up visits with a qualified therapist to make sure that all issues have been treated. Many parents of children with ADHD say that they believe their children are highly oppositional in addition to having ADHD. One thing we are mindful of as therapists is that in some kids, once their ADHD is treated, we may see a significant reduction of oppositional behavior. Effective treatment of ADHD does not guarantee that their children will be less oppositional. Children with ADHD by nature do not follow directions. They are poor listeners and often do not pay attention to things we ask them to do. So we typically hold off on making an additional diagnosis of oppositional defiant disorder until we see if the treatment of ADHD results in overall behavioral improvements. If the child is still oppositional when the ADHD symptoms have decreased, then the oppositional defiant disorder, or ODD, can be added at that time. There are times, though, when there is sufficient or overwhelming evidence to support making two diagnoses at the same time. For instance, I have seen plenty of children who have a long-standing history of anxiety. Their symptoms of anxiety are truly separate symptoms from their ADHD. In these cases, it is completely acceptable to make two diagnoses at the same time. We just recommend that if there is any doubt that another behavior or emotional concern is stemming from the ADHD, that we treat one problem at a time before assuming we have two different problems. Speaking of treatment, let's talk about treatment issues. The general consensus in the field is that a combination of cognitive behavioral therapy plus medication is the gold standard of treatment, especially for children who have severe symptoms. Medication can often make the child benefit more from behavioral treatment by managing the most severe symptoms of ADHD. One thing that is clear, behavior management techniques are a critical component of ADHD treatment programs. In 2008, a study was published that reviewed behavior treatments for ADHD to identify those that had a strong research support. There are three general categories of behavioral treatments that are considered well established: behavior management techniques by parents, classroom behavior management strategies, and behavioral peer interventions. So, if you are looking for treatment for ADHD, ask a therapist if they have expertise in these areas. Soon, we will have a video on the techniques that goes into more detail, so stay tuned. As you can see from this video, there are many things we need to consider when evaluating a child to see if they have ADHD. An accurate diagnosis will lead to an accurate treatment, so it's best to spend the time up front to make sure all other behavioral and emotional issues are considered before assuming it is ADHD. Thanks so much for watching, and we hope you find this information beneficial.